key Senate committee is now calling for the immediate disposal of all COVID-19 supplies procured by the National Medical Agency, KEMSA. Now, the Health Committee says urgent sale of the items at current market prices is the only way to minimize losses. The items were purchased at exorbitant prices and now run the risk of expiration. Let's get more from our very own Dorcas Wangira.
The Senate's Standing Committee on Health that has been probing the KEMSA procurement scandal tabled its report Wednesday with damning findings on the Medical Supplies Agency. The committee determined that the products purchased by KEMSA for purposes of containing the COVID-19 pandemic cost the taxpayer 7.6 billion shillings, with a bulk of it worth 5.9 billion shillings still lying in KEMSA's warehouses. Only health products worth 1.8 billion having been sold. This follows the committee's site visit to the KEMSA offices and warehouse on Tuesday, 1st December 2020. The projected loss to KEMSA was about 2.9 billion shillings if goods were sold at current market rates. This figure increases with time as the market prices are getting lower. To prevent this loss to the taxpayer, the committee recommends that the Ministry of Health should authorize KEMSA to dispose of medical items that were procured in response to the COVID-19 pandemic at prevailing market prices to reduce the losses being incurred by the agency. KEMSA, however, has already paid some suppliers 4.7 billion shillings and still owes other suppliers 7.6 billion shillings. With regard to PPEs, the current stock was 317,409 units and stock that was ready for sale was 115,690 units. Negotiations for the goods between KEMSA and the suppliers were yet to be completed. This was on account of a letter from the EACC suspending all procurement processes pending investigations. However, EACC's investigations into the alleged irregularities in the procurement and payment singled out 52 persons of interest who were interviewed and their statements recorded. Their cases still awaiting the decision of the DPP for further action.
That question is actually superfluous. No.
Among those who were recommended for investigation were Dr. John Manjari, the former CEO of KEMSA, Charles Juma, the former procurement director, Eliud Mureithi, former commercial director, Frederick Wanyonyi, former director, legal services, Edward Njoroge Juguna, former operations director, and Waiganjo Karanja, the director of finance and strategy. The committee's report also recommended that the office of the DPP and DCI investigate the companies awarded tenders by KEMSA, such as those who had been in existence for less than 3 years prior to the award of the tender. The committee further recommended the review of the KEMSA Act to ensure that counties are allowed to procure medical items from entities other than KEMSA. Dorcas Wangira, Citizen TV, Nairobi.